Hi everyone, this is Dr. Armen Vartany, and we are here in our office in Burbank, California, and today we have Lacey from Embrace, who is going to demonstrate a new product which we're very excited about. We're going to try it out. What we're going to do, we have a patient here who had a tummy tuck 2 weeks, no more than about a month ago, and we want to, and this is a silicone product which is used for minimizing scars. And as you know, with a lot of surgeries in plastic surgery, the scar is the biggest problem, concern, and one of them is a tummy tuck, which with tummy tuck breast reductions have scars that can be troublesome if they turn out to be thick scars, and this product claims to minimize the scars. Yes. So we're going to find out how that works. So Lacey will apply it to half the scar, and so the other half we'll see if there's a difference, and we will have another video session probably a few months after this and show what the difference is. Okay. So Lacey, you want to tell us a little about the product?
So Embrace, this is a 16 centimeter Embrace dressing, and it is a silicone sheet that has an adhesive on it, and there is no medicine in it. It's all in the offloading of the tension that's going to be the big difference for this. So the difference between this and other silicone products is that this has it's a tension reducing. Slightly larger on the skin because we're going to actually stretch the dressing before application, and then we'll apply it to the skin, and then we'll release it from the applicator, and once we do that, it will spring back, pulling together, yes, taking the tension off the incision. Yeah. The great thing about this is that it's going to stay on for a minimum of 10 days, so the patient can shower with it and they don't have to worry about it either.
Oh, well, that's great. So. Yeah, in the past we used to put tapes, sure, like Steri-strips, to minimize tension.
Yep.
And apply silicone. So this product does both.
Sure, same concept.
Okay, yeah, takes the tension off and applies silicone. And it's the contact of the silicone with the scar that has a beneficial effect to the scar.
So it's very easy to apply. Patients can even do this at home themselves. What you do is just trim the hair, make sure it's a little bit short there, and then just take some alcohol, and you're just going to cleanse the skin on the area where you're going to do the application, just to make sure you get off any oils or lotions or ointments that the patient may have on their skin.
So is this something that there's a video for them to watch, or?
Yes, we do have application videos
online.
Yes.
Okay, because this is not a simple just peel and apply type thing.
Well, we want it to be as simple as possible. Yeah. Sometimes you may need an extra hand at home if you're doing an application on the breast or the arm, somewhere where you need, an extra set of hands. But it's relatively easy.
But if you want the patient to be totally flat, someone else has to apply it.
Well, the videos online show the patient standing in front of a mirror.
Standing can work too.
Yeah, you can be standing as well.
Okay.
So we're going to take the dressing, and we're going to fold it back, just like that. And then you have a guide here that shows you where you want your dressing to be approximated. And we're not going to apply it over any scabs or open areas, so we're going to go here. The one thing that I will do is kind of just pull up on the skin where there's a little bit of laxity out here, because we want the same amount of tension across the whole area where we're going to apply.
Okay, you want to pull that?
So yes, if you can. So then we're just going to take this, and we're going to line that up right along the incision. And it doesn't have to be right center on the incision. We sometimes will offset it a little bit if the incision is lower, because we don't want the dressing too low on the leg, whereas they are walking and pulling on that, and it can cause irritation. So once you set the dressing onto the skin, you're just going to take about 30 seconds to rub and make contact with the skin. These are pressure and heat sensitive, so this adhesive will really adhere once you get a little bit of warmth to it.
Yeah. And how long does this usually stay if you don't take it off you?
This will stay on 10 days. Some people have worn it a little bit longer. It really just depends on how active the patient is. But usually when I put these on patients, I tell them not to shower for the first 4 hours. And even if they want to wait till the next day, that's fine as well. And then you should be able to shower as normal and normal activities as far as what you're allowed to do after.
Okay, so
surgery.
after it comes off, it starts peeling off, then or falls off, then that's it. Yeah, you can't reuse it.
It really just depends if the patient's doing their changes themselves. If they're coming into the office to have them done, you're just going to have to schedule that with the office. So usually you'll take it off the evening before. You're going to do another application. Just give a little break in between each application.
Okay.
And then set up your next one or do it yourself at home.
Okay.
So after you've rubbed it for about 30 seconds, you're just going to hold pressure here. And we have these little strips. I'm not sure if you can see them from that direction, but they're just going to pull straight out to the side here.
Okay.
And then you're just going to give it another good rub. Sorry, are you okay? And then your dressing is on. And then usually what I do, my hand is a little bit cold, but I'll just take my hand, put a little pressure on there for about 5 or 10 seconds. See if there's any air bubbles, which I don't see. If there are, you're just going to kind of push down and make them move on out.
Okay. All right. Now, Lacey, when you said you've used this product for about 4 years.
Yes.
And normally, at what point do you see a difference? Like,
patients, in my opinion, start seeing a difference after the first 2 applications.
So after about 20 days?
Yeah.
3 weeks?
Yeah.
Okay.
They'll notice it. They actually love to have it on. They love the compression that it gives, the security that it gives. They feel that it's more comfortable to have this on just because there's a barrier between them and anything that may be rubbing on their incision as well.
Yeah.
So a lot of times we'll hear from patients that they want to put it back on. They can't wait to get their embrace
But
back.
as far as the scar, as far as the, like at what point do you think she will see a difference from this side to this side?
I think she'll start seeing it pretty quickly.
Within 3 weeks?
Yeah.
Okay.
2 to 3 weeks.
Okay. All right. That's exciting.
Yes.
Okay. So yeah, I mean, I wanted to do it half and half so we can compare it, and I like to see the result, talk to the patient, see if the patient sees a difference, and also feel it, see if there's if the scar is softer, any different, and that's this. I'm very happy that Lacey was willing to come and demonstrate this, and so we will have another probably video session in about a month and see what the results are. Okay, thank you very much for joining us, and you can read more about tummy tucks and scars and the breast reductions on our website at vartany.com. Thank you.